Very shortly after we began our work as a demonstration site, I coincidentally heard from an old friend who used to be my patient. And this man, who's in his early 60s, had had a positive PSA and was diagnosed with prostate cancer about 5 years ago. He made the decision at that time to follow his cancer with watchful waiting, but not engage in any active treatment. And he was beginning to have second thoughts about the decision he made and whether he made the right decision and whether he should continue to not be treated. I thought that he would benefit from watching the prostate cancer treatment decision aid, so I took a copy and gave it to him. And what he told me when I heard from him a few weeks later was that he had watched the decision aid. He watched it with his wife, and then at a family gathering watched it with all of his children as well. He said he found the information tremendously helpful. I don't know exactly what he's decided to do going forward, since I'm no longer his physician, but I do know that he made it clear to me that the decision aid was a great help, not only for him but for his family, to understand the pros and cons of various options, and he felt that he was in a better position to make a decision as a result of watching the decision aid. Okay. A lot of my work is to improve mental health care and primary care, and to do that work we have a patient and family advisory group that meets with us every couple months, and we've been meeting together now for at least 3 years. Early in our participation as a demonstration site, I brought the depression decision aid to this group to get some feedback about what they thought of the decision aid. The response was generally very positive. People felt the information was well presented and very useful. There was some concern expressed about the length of the decision aid, and in discussion they recognized that a patient could choose to watch it in pieces, especially a patient dealing with depression who maybe would have trouble concentrating. But it also made me think that the availability, the ultimate availability of web-based decision aids that could be watched more in chunks than from beginning to end would be useful, and so I'm looking forward to having the opportunity to try that approach. One of our demonstration sites chose to use the colon cancer screening decision aid as the first one that they would test. This is a practice that's been tracking their colon cancer screening rate for some time. They've been very good about giving the decision aid out to patients and have given it out to about 50 patients in just a couple of months. I heard from the lead physician from that practice who told me that since they've been using the decision aid, patients are coming in much more prepared for the discussion about their colon cancer screening options, and he feels that it's made it a much more efficient visit for him to talk to somebody about colon cancer screening. And in addition, they've seen a definite increase in their colon cancer screening rate just in the couple of months since they've been giving out the decision aid.